please email ert@thefcacdst.org to provide a status update. Also, Saras, during the COVID-19 pandemic, please remember to wear your mask, wash your hands, and always walk and stand 6 feet apart from others. Please continue to be safe and always be Delta ready. Welcome.
Hello, everyone. I'm Toni McIntosh Harper, President of the Federal City Alumni Chapter, and I bring you warm greetings on behalf of our nearly 800 members. Welcome, and thank you for joining us during your lunchtime to discuss something that is so important to all of us during this pandemic. We hope that you leave this virtual space informed about the COVID vaccines. Thank you to the Emergency Response Committee for putting this program together, and a special thank you to Ms. Anita Jenkins, CEO of Howard University Hospital, who has joined us today to answer your questions. Check out our website, www.thefcacdst.org, for more information about our upcoming programs and events. Again, thank you and welcome.
Thank you, SOAR President. My name is Kelly Crawford. I'm a member of the FCAC Emergency Response Committee, and I'm so happy to bring this presentation to you today. We have our special guest with us, who is Anita Jenkins. She is the Chief Executive Officer of Howard University Hospital right here in DC. She joined Howard University Hospital last February, but she comes with a over 20-year career in healthcare experience. She holds a master's in business administration from Walden University and a bachelor's degree in business and management from Barrett University in Danville, Virginia. She loves volunteering for health organizations, and we are so excited to have her here with us to talk about the vaccine and also share with us her vision as the new CEO of Howard University Hospital. Thank you, Anita, for joining us today.
It's indeed my pleasure. Thank you for having me.
So just to get started, could you tell us a little bit about your vision for Howard Hospital and what your plans for improving the delivery of services at the hospital in general for our community?
Absolutely. So once again, Kelly, I want to thank you very, very much for inviting me to this distinguished group. So I was born and raised in Pittsburgh, Pennsylvania, and I started my career as a respiratory therapist. Worked night shift in critical care and trauma, and then lived and worked in Huntsville, Alabama, while continuing school. And so, like many of us, my parents could not afford for me to go to school, college full time. And so, while married and raising children, those kinds of things, I went to school and went to school and went to school and went to school. So I went to school for music first, because you have to feed your passions, and then you have to know where I have to eat. So and then went to school for business. Lived and worked in Danville, Virginia. That's where my leadership started. In Danville, I was everything from a supervisor, a department coordinator, a manager. And then in Ohio, I worked for 2 different networks where I was a vice president, a network vice president, and then at a different hospital organization, I was. I'm getting to a reason why I'm telling you this story this way. I was the COO of the largest hospital, a Caring Health Network, and then the president of one of their hospitals. You asked me why I came to Howard and what my vision is for Howard. I wasn't looking. And when I got a telephone call, at the time I was president of a top performing hospital. It was a top 100 hospital 11 times. It was a leapfrog A. And that means the best grade that you can get in quality and safety. Every hospital is judged by leapfrog outcomes. That's just from the scores that you give to insurance companies like Center for Medicare and Medicaid Services. And we were a 5-star CMS rating for safety and quality. When I got the call, and while I was on the call, it was a random telephone call. I Googled Howard University Hospital. I knew about Howard and of course known about the great Howard University, but not so much about the hospital. And as I looked, I saw that there was great opportunity for the healthcare organization itself, and understanding its history as it was the former Freedmen's Hospital more than 100 years ago, and it was created to care for formerly enslaved persons. I just had to think to myself, and as we discussed it with my husband and family, it was like, this is really something that I want to be a part of, to transform Howard University Hospital, a historically Black hospital, but a hospital in a changing city. Howard University Hospital should be, and it deserves to be, the top performing hospital in Washington, D.C., and a world-class hospital in the United States. And I tell my team that all the time. We ought to go big, ladies. We got to go big when we're thinking about what our work is. So my vision for the hospital is indeed to turn around our culture, to work toward culture, to work toward quality and safety, and to really be a top performing hospital in the United States. So with that, I started working here February 17th, 2020. And so did COVID. And I just thought, oh, what kind of bad juju is this? No, or I was just simply thinking, well, look at God. You know, I had to know that he's on purpose, and his timing is on purpose and deliberate. So we started, and I was able to see in this new team of leaders, we've got an amazing new group of C-suite persons that came here just like I did, to just say, you know, I want to be a part of this historically Black hospital, to be one of the best. And it has been some work to go through the journey of COVID, to go through the journey of a second wave and create more hospital beds. And I remember Mayor Bowser called me on my cell phone, which I was a little bit starstruck. She called me on the phone and she said, I'm calling all of the hospital CEOs, and I need for them to be able to take on extra beds. And what do we need to do to get this done? And I was like, anything you want, Miss Black Lives Matter in the middle of the street. And, you know, I just really was very excited to be a part of taking care of COVID. In the fall, I started hearing, and all of us started hearing about companies working on vaccines. And I'll take your questions, but I'm just going to tell you, it was exciting for me to think that, oh my goodness, we're going to find a solution to this scourge that's killing thousands and thousands every day. As a respiratory therapist, or as an old respiratory therapist, I knew exactly what we were talking about when we were talking about our ventilator care and the respiratory diseases and how it was killing. And then we were really, I remember when the CMO came in my office, the chief medical officer, she came in my office and she said, we're starting to see more Black people die from it than others. I said, what are you saying? She said, we're seeing it. We're not quite clear about why it's happening, but the numbers are rising that Blacks are dying more and getting it more. We now know that it was because we were seeing a sicker population and that they were going into the COVID disease and its effect and hitting us harder. So to know about a vaccine was good news to me. And then I started hearing from my staff members. We did a poll here at Howard University Hospital, and we have well over 2,000 staff members. 70% of the staff, 70% did not want to get the vaccine. So then I knew I had to really educate my team. Let's put aside all of the voodoo. Let's put aside all of our history. Let's think about the science. Let's talk about this. And I'll take your questions, or I'll keep talking about it. But it was a blessing to be able to say every day, here are the FAQs. Here's some facts about vaccines. Here's some facts about COVID and how it affects us. And here's what we can do about it. So we have now vaccinated, remember 70% didn't want to take it. We have now vaccinated about 60% of our staff, including myself, which my team said, if you take it, I'll take it. So at Howard University and Howard University Hospital, I was the first to get the Pfizer. I was the first to get the vaccine here because I believe in its efficacy, and I believe that it is what we can do to help save our lives. And so that's why I'm here, and I'm so excited to talk about you. I hope that was a good intro.
That was absolutely perfect, Anita. Thank you so much. I know that I'm sure people have questions. I have a couple just questions that we got before we started. So you've already talked about the hospital staff, and thank you for sharing that information. When you think about COVID, I know one of the long-term issues is that hospitals have been seeing people not come in when they have non-COVID related issues. And if you could just speak to how important it is to come into the hospital and that it's safe.
Thank you for that shameless plug for healthcare and taking care of ourselves. We are absolutely seeing, it's called delay in care. So, you know, you have somebody with an umbilical hernia, right? And you have someone and they're like, oh, I've been having trouble with this for years. And they ignore those symptoms. And then the next thing you know, they've got an occluded colon, or they need abdominal surgery, or they've had this chest pain. And as you know, you beautiful women, as I can see the gallery on my screen, women, so first of all, I will say Black women have more cardiac diseases and die from it more than white women. Women die from cardiac diseases across the board more than men. I don't know if we are not paying attention to our own signs and symptoms that we have, but there is one thing, serious cardiac disease. We have different, as women, all women, Black and any other kind of, all women have different symptoms than men. More often than not, men have the whole big, oh, crushing pain, I'm having a heart attack. Women have, you know, I've had this pain in the middle of my back, or my throat hurts on the side. My arm is hurting just a little bit. I don't know if I did something unique. Women tend to not connect those signs. So we have pains, we have symptoms, and we have chronic diseases that we are ignoring because we are afraid to come into hospitals. I will tell you, we have long since made the hospitals a much, much safer place. Doctor's office is much, much safer than your grocery store, let's be very clear. And if you are all over this country, much, much safer than grocery stores and stores where you are in states that might be this beautiful red that you're wearing, if you understand what I'm saying. Our 5 children live in the Ohio region, and that's a very red state. And we went to visit them a little bit more, you know, we went to the store for the first time and we went to visit our children just a week ago. And I was shocked about how many people were not wearing masks. So when it comes to coming to your doctor's office and coming into the hospital for care and for tests and for treatment, please understand, you must take care of yourself. First of all, get a vaccine and protect yourself. And understand that we have created an environment. We've been working on this for over a year to make sure that you get the care you need in a safe manner, whether you need an x-ray, whether you get a mammogram. Do you understand that we are starting to see very advanced cancers because women have put off their mammogram screening? Cut that out, ladies. Please go get your mammogram. You have to live, we need you. And our world needs you. And our world needs you. So yes.
So just to turn our attention just to a little bit more information about the vaccine itself, could you just talk about the type of vaccine that Howard is administering through the clinic, and then also side effects, how long does it take to receive full immunization, and just the vaccination process, what they can expect?
Absolutely. So Howard University and one other hospital were the first hospitals to receive vaccines in the district. I insisted on that. They were like, "Are you willing to get vaccines?" I was like, "Heck yeah!" And so we got vaccines. Some of the first, we got it on December 14th or 13th, and I got my vaccine on the 14th, the very next day. Hospitals received Pfizer's because, as you know, Pfizer's have a different temperature requirement, and hospitals and hospital labs have those special freezers that go to 70, 80 degrees below. And so we were first to get Pfizer's. Pfizer was the first to get FDA approved, so we were getting those. Pfizer's, of course, are the weeks apart that you have to get, and Moderna is 4 weeks. Pfizer's 3 weeks apart. Moderna's 4 weeks apart. We got Moderna's next. So we had those require a little less refrigeration. Both are highly effective and render you about 94, 95% protected from the virus. And now we have Johnson & Johnson, which their efficacy is very high as well. The first news that came out is not the scientific results. They are also very high in their effectiveness, but it's a one and done with the Johnson vaccine. So they all, whichever one that you can get, they really do protect you. So I wouldn't care about getting any vaccine. A couple of weeks after you get your final shot is when you are fully vaccinated. After you get your first vaccine, you're about 50% protected. And then when you get your second vaccine for those two-shot vaccines, a couple of weeks after that, you're fully inoculated. The science that's coming out right now, and they're still looking at it, and I'm going to talk about this misnomer that it was created too fast. Remind me to talk about that. But the science, they're saying now that they do think that it should cover you. It is covering the variants very well. The science behind that, Moderna had a little bit more time to think about it, and Johnson & Johnson really, to research it, and Johnson & Johnson really had time to research it, but they all have had time to research it. It is doing a good job of covering the variants that are occurring. So don't forget, viruses are alive and they do change. That's why they recommend a flu shot every year, because the influenza changes every year, and that's why you have to get that. So when you start talking about your vaccines, that you are protected, and it's covering about, they're saying about a year. Will we probably need a booster? Probably. Dr. Fauci is saying that we'll probably need a booster coming down the pike. But you know what? Your children got booster shots when they got measles, mumps, and rubella. We know that you need booster shots. That's how that works. And so that's not a strange thing. It is protecting us and keeping us protected. You ask a few questions.
I think you covered it. I want to give you the opportunity to go back to speak to those that might say that they rushed the vaccine or they created it too fast, and perhaps that might be not as safe as other vaccines that we're experienced with getting every year.
Happy to. So if you look up coronavirus, and you know why it's called coronavirus, because it's that's Spanish for crown, and it looks like it has these little spikes on it that look like a crown. Coronavirus, the first case of coronavirus was discovered about 50 years ago at Michigan University, I believe it is. We have known about coronaviruses. If you look at your Lysol, if you looked at your Lysol container that it fights Lysol, the spray, it says it kills coronavirus, and it has said that forever, because coronaviruses have been around a long time, decades. Fighting and creating vaccines and doing research is fully dependent on money. You know that, for all of those who work in, all of those who are university folks, professionals in the room, it's fully depending on money sometimes. But they've always studied the coronavirus, and they've always studied the mRNA methodology of vaccines. So it wasn't new. They didn't start, so the first case in the United States, anyway, the first verified case was January-ish or so of 20 of last year in the United States. I believe it was discovered in November-ish of 19. And let's be clear, so they've had coronaviruses have been all around a long time. COVID-19 is the version that we've been fighting for the last year, discovered in 2019. That's why it's called COVID-19. And so that's why there's two different sayings about that. You got coronavirus and they got COVID-19. That's the one we've been fighting for the last year or so. So when it comes to, did they rush the vaccine? Absolutely not. I know for a fact, and I watched it on a documentary, that Pfizer particularly, Pfizer said, I am writing you, they went to a research company and said, I'm writing you a blank check. And that check got to the B's, billions. I need for you to throw everything. I want every scientist, I want every computer, I want you to research this. We need a vaccine and we need it as soon as possible. The reason why they were able to create a vaccine quickly is because they've already been working on coronavirus. They know what it is. And then they got a lot of interest. Why did they get a lot of interest? Because it was worldwide. This is a worldwide pandemic, and the whole world needed to work on this. We could not, as a healthcare and research and scientific community all over the world, we had to put the pedal to the metal, and we had to get there faster. They did not rush anything. The FDA did go through every stringent methodology that they use to approve vaccines or drugs. America is a little bit more fussy. They FDA actually is a little bit harder on the releasing of drugs and vaccines than the rest of the world. And they did see that the scientific methodologies on testing and research and clinical trials was valid enough for us to say, yes, this does fight COVID-19. And let's be clear, and many of the studies had a good deal of Black and brown people who were a part of the research studies. Don't think that they only studied this kind of people, which happens with women and medicine. Let's be clear, they often do research on men only. They did it with a lot of cardiac medicines. And then we found that cardiac medicines weren't working for women. But about 10% of many of the larger studies were Black and brown people. And so we do know how the coronavirus vaccine functioned and worked and was successful. And they were able to see that it does fight the coronavirus.
So just to expand on that a little bit more, what would you say to folks who are not interested in getting the vaccine because they don't believe that it was intended for them or intended for certain demographics? What would you say to Black women? What would you say to young men who think that, oh, this vaccine is not for me or wasn't intended for me or developed for me?
There are a couple of things. It is so unfortunate that this disease and its treatment and its cure was politicized. Shame on everybody who did that. When you start talking about a disease that's killing people and wiping out whole families, and 500,000 people in the United States alone, and then you get on a TV station and say that it's fake or false, yet you get the vaccine yourself. Or someone says, okay, we do have a successful vaccine, and we name it by someone. It's just eliminating trust issues in healthcare. And everybody on this call, I'm sure, has had a less than positive. And I love healthcare. Since I was a respiratory therapist, I've loved taking care of people and relieving their pain or their stress. I have held people's hands as they passed away, or held their hands as I put a tube down their throat as a respiratory therapist to help them breathe. I've done it, and I love healthcare. I am a believer. I'm a faith-based person, and I believe it is what God or Christ wants us to be. He did more than preach gospel. He healed, and healed first for those who believe. And I just think it is terrible that we somehow made it less than a healthcare conversation. Healthcare has not been faithful to Black and brown people in the United States. It has not been kind. We have, my oldest daughter, she's the director of human resources at Indiana University, Easton, Indiana. And she drives an hour and a half because she trusts the physician that takes care of her. Pays more because she goes out of state. She ends up going into Ohio for the care that she believes she deserves and needs. Shame on healthcare for that. For that to happen. Shame on us. And we will do better and must do better. And that's why I'm at Howard, because I think we have an opportunity to do better here to prove to Black, brown people, and anybody else that healthcare should be fair and compassionate. When you start talking about young people or older people not trusting healthcare, that mistrust is fair. You can still go online and look up articles that say Black people don't feel as much pain as white people. You know what that translates to? That means they don't even get as much pain medicine, or our pain is not believed, and therefore we don't get the same care and outcomes as other people, because that foolishness is still out there. Of course, we know about the Tuskegee experiments. Of course we do. Tuskegee experiments, of course, were cruel and insane. It was maddening. And I just had to explain yesterday, well, why should I believe you? Don't you know there was a woman who was encouraging people to get into the Tuskegee experiment? Well, she was used. She was used, and she believed and trusted like everybody else. And she should have been able to trust. And she was used and a pawn, and it's a shame. But please understand, this is not an American virus. This is not an American healthcare crisis. This is a worldwide virus with a worldwide vaccine solution that will help save our lives. We are dying 3 to 8 times more, depending on the pocket of Black people you're talking about. We are getting the virus 3 to 8 times more, depending on certain areas. So for instance, ladies like you and me, who might have a better understanding about healthcare, you know, and have better healthcare. So the healthcare outcomes have way more to do than the virus as well. Let's be clear, when you start talking about healthcare inequities, you live in a pocket of people who don't have the same access to good groceries and good health food. You know, they can't afford Whole Foods, because as you know, it takes your whole check to shop at Whole Foods because it's organic foods and it's expensive. So they're not getting organic foods or getting foods, or they're a single mother who has to cook quickly for the children that she has, or cheap food, fatty food, salt food, and bad food, McDonald's, is far easier, faster, and cheaper to give your children than cooking whole foods and real foods. So you end up with a population that has more diabetes, has more heart disease, has more hypertension, has more predispositions that when that virus hits us, it takes you out. We, of course, had people in their 20s who have passed away because they started out unhealthy. So when we start talking about why don't we trust healthcare, how about why don't we start thinking about how we can serve our communities to be in a better health place in the first place, and then we can say, healthcare, cut it out. You treat us the same, you make sure your research is the same, you make sure that we are getting the same compassionate care and reasonable care so that we are getting that same those same healthcare outcomes. It is fair that they don't trust it, but please understand, this is science. Why don't you see, I am old enough to remember people in braces on their legs and leather straps on their legs. Who's in the room? I'm not going to prejudge how we look in the room because I know you all look 20 years younger than what you really are. But I remember braces, wheelchairs, and iron lungs. But why don't you see it today? Because polio was cured by a vaccine. It was a successful vaccine. And I know that Black and brown people took it because we don't see you in these braces. And so we have to be reasonable and think reasonable. Well, of course we're scared, but let's be practical about this. This vaccine is going to help us. I've now had my vaccine for 4 months. I feel just fine. My reactions were reasonable, like any other reaction. And why do you have a reaction? Because your body is now telling it what to do. Your body knows, I know how to fight against coronavirus. I'm going to get a fever for a minute. Everybody who's had children in the room, they know they get their vaccines and they're going to feel a little pukey for a couple of days. They're going to get a little fever, they're going to be a little cranky, and they're going to have a little sore arm, and they're going to be fine, and they're going to be inoculated against measles, mumps, rubella, whooping cough, and all of that. Does that make sense?
That makes perfect sense. I also, today is like my official 21 days after my second shot. I'm fully inoculated. I got my my vaccination appointment at Howard University Hospital. I was actually born at Howard University Hospital, and in the fall, when I came down with COVID and I was in the ambulance took me to Howard University Hospital. So
I'm here. I was in a full panic. My computer, my screen went blank. Go ahead.
So we just had the announcement from our mayor that effective April 19, everyone in our community is eligible to receive the vaccine. And I'm going to put in the chat the website to go to pre-register for the vaccine, encouraging everyone to go in and sign up. And like Ms. Jenkins said, the first available vaccine that you're able to get, take it. They're all safe and effective. I'd like to invite anyone, if you have any questions that you have that are burning in your mind, anything in particular that you would like to ask, we have a couple minutes to take questions from you. So you can just go ahead and drop them in the chat or raise your hand. I believe there's the hand raise feature. And while we're seeing if there's any questions, I do want to thank our Eastern Regional Emergency Response Team Coordinator, Sora Cindy Douglas, for joining us today. Thank you for joining us. And I hope that you're learning a lot from Ms. Jenkins here. We're so happy to have her with us. So I have one question here. Do we still need to get tested after you get the coronavirus vaccine? Do you still need to do testing?
So you do not. It's interesting what to do after you are fully vaccinated and you are around a known carrier. If you are around a known, somebody who is, they were sick and you were near them and all of that kind of stuff. What I do recommend is that you still wear your masks when you are confident that you're around people who have not been vaccinated. So you do have to be careful because you still can kind of spread it, right? So if you're around someone and you touch someone, you haven't washed their hands, and then you touch something else and they touch, you got this. We just need to make sure that we are still protecting ourselves with masks. You won't get it, right? But you can't say that you can't spread it somehow, right? Does that make sense? Okay.
So once you're fully vaccinated, what are your thoughts on folks traveling, doing the things that we haven't done in a year, like going to see our grandparents, and especially, and then also could you speak to especially being around children who aren't eligible for the vaccine right now?
Sure. Once you are vaccinated, and so please understand, I'm not speaking off my head. I've just been very, very well trained by a lot of amazing scientists and persons. And I just found out that I live in Dr. Fauci's neighborhood. Woo! I am so sorry. I get right silly when I found that out. I found out because the local store, somebody was talking about Dr. Fauci, and they were like, "Yeah, he's in here all the time." I said, "Are you kidding?" He goes, "Yeah, he lives near here," and I was like, "Yeah, you're kidding." So anyway, and what we know is that once you are fully vaccinated and you are going to visit your grandparents who are fully vaccinated, it is safe to be around them, and they are safe to be around you. Young children, like the 2 grandchildren that we have, they are seeing that with this variant, it is important for you to protect your children. So they need to wear masks, the little ones, they need to wear masks when they go out, and you've got to make sure that you're protecting them, washing their hands, making sure they're wearing masks, and making sure they're wearing masks in public, but you are safe to be around your children and your little ones. So with our grandparents, so my husband and I just went to visit. We've got 2, one 8 years old and one 1. And while that 8-year-old, and it's interesting, the 1-year-old has already had coronavirus. How do we know that? Because our hard-headed second to youngest son, who's her father, refused to wear his mask. "Oh, I wear my mask when I go to the gym," and he got coronavirus. And the little one got sick as well, and they did test her, and she did get sick. So she wasn't very sick at all. But we are seeing that kids can be quite ill. The 8-year-old, our 8-year-old granddaughter, they can be quite ill. So you do have to protect them, wash their hands and all that stuff. But once you are protected, you can't give it to them. You just got to make sure that the kids are, and your grandparents. And I am comfortable traveling. I am very careful. We do wear our mask. We flew to Ohio just this past weekend to see our kids. Woo-hoo. And so we did protect ourselves. You take, I'm sorry, it's not coronavirus. I've just been talking a lot. Okay. You make sure you take lots and lots of hand sanitizer with you. Take that little swipe at the they give you a little swipe on the airplane for you to wipe off everything. Do that. Wipe off everything, wipe off your tray, wipe off your handles, wipe off the seatbelt, throw that away, hand sanitize yourself. Just do all of those things. And I feel completely comfortable flying. And so yes, I would fly. What I want to do, and we want to make sure that the place we're going is safe. So we've been going straight from here in Washington, D.C. to our kids' home, and we're good, and they're vaccinated. So I want to travel. I really, really want to put my feet in some sand somewhere. And I know it. I'm looking at the president, Tony. It's like, "Oh, please let me see some sand in a palm tree." So we are really considering, how soon can we do that? So haven't done any of that yet. But we had the bug so badly. Our anniversary is in March, that we went in 30-degree weather, went to Ocean City, Maryland, and because my husband scooped me up, he goes, "Oh, you need a break." He scooped me up, we drove over there, and I walked on the beach and looked at the ocean in boots, a hat, and a coat, and it was really, really soothing. I was like, yay, but now I need to put my COVID body, my COVID pounds in a swimsuit and really see the ocean, but it's too bad on whoever's on that beach.
So we have a couple more questions. We have a couple more questions that came in. You spoke a little bit about feeling comfortable traveling. What would you say to those who are considering whether or not to send their children back to in-person learning?
So it all depends on what your school has in place. You're going to have to make that decision. So my daughter and her husband in Indiana, a red state, they never shut down school in my granddaughter's school. They offered both. My granddaughter was the only child that was doing home learning because they all went. And sure enough, several teachers got COVID, several students in the upper grades got COVID, and they weren't safe. Now, though, the teachers are vaccinated, they have processes, the kids wear masks, they've got separated desks, they're more prepared, in my opinion. And my granddaughter went back to school about 3 weeks ago. I can't tell you what to do for you, your children, or your grandchildren, but check out what the school is doing. It's not just automatically going to be safer. Is this school responsible? How do they make sure that kids aren't sick? Or how do they make sure that the teachers don't have a fever? Or how do they handle an outbreak? You get 1 or 2 teachers, you've got a problem. You've got coronavirus in your school if it's more than one. So that's how you have to look at that. You really have to take care of ourselves, and we have to be selfish about our healthcare through this virus. And we're not done. We're not done. The variants are popping up and rising back up again in certain states. We're doing fairly well in Washington, D.C. We're fairly flat. I have had 9 or 10 coronavirus patients and much, much less critical care patients. So that's really good news. I only have 2 critical care out of 10, day before yesterday. Today, we popped up to 14 for the first time in a couple of weeks. So I'm watching this very carefully. Am I watching a rise, or did we just have a few more that are hospitalized? I'm hoping that we are not seeing an uptick, but don't get lazy on this one. We still have to wear our masks. We still have to wash our hands. We still have to social distance, because you don't know what this other person beside you in the grocery store has or doesn't care about doing. You know, this arrogant lack of caring for others, you know, is people aren't washing their hands, and they've always been dirty gerties. These are the people who've gone in the bathrooms and not washed their hands when they come out of the bathroom. So they were nasty years ago. And so just nasty years ago. And so now they're nasty and dirty and infectious. So they've always been. I'm very sorry, I'm getting way too comfortable because I'm seeing your beautiful face. These people have always been nasty, and now they're infectious. So just take care of yourself.
You're hilarious. We have just a few more minutes. I just want to give you an opportunity just to reflect on, I know you came into the district just right before COVID hit. And I just want you, when you look at like what some of your colleagues are facing across the country, what are you most proud of in terms of the districts, and especially Howard's response to coronavirus, and your outlook for what the next year is going to look like?
So, okay, healthcare gets a bad name. We've talked about healthcare and health inequities, sure. But I'm proud to be in this industry. Healthcare is an industry where our customers don't want to be with us, right? It's not like me and my shoes, my shoe, Kelly, me and my shoes. Shoe shopping, people want to be there. Nobody wants, except for maybe a healthy baby, nobody wants to come into a hospital, not even to get a mole removed, but certainly not for open heart surgery or for an accident, right? So we care for a consumer that doesn't want to take care of us. I'm proud to be in that kind of business that helps people. It is a blessing, and I've been proud to work through COVID. You know, I did not miss a day. I did not work from home. And I'm not bragging on myself. My whole team, we were all here because as nurses and doctors were at bedside, we were here trying to make sure that they had everything that they needed. The district fought hard. I mean, we met with all of the hospital associations, sometimes 3 times a week, sometimes 4 times a week. We met with Adventist Healthcare. The Adventist Healthcare is the healthcare organization that manages Howard University Hospital. Adventist Healthcare is the faith-based organization in Maryland who we are looking to own Howard and build a new hospital right here in the district so that Howard University Hospital's legacy gets better and bigger. I just know that we really tried every day just to do our best for everyone. To provide high quality care to every person every time is what we tried to do. We were fighting a disease we didn't know. I mean, we're like, whoa, what do you mean they're having heart attacks? Whoa, what do you mean the diabetics are dying more? What do you mean? I mean, it was for a while, every other week, we were getting new CDC guidelines and we had to change and bend and communicate differently. It was the career journey of my life. And I thank you for saying that I've been in healthcare for 20 years. I'll take 20, but it's been a whole lot longer than that. But it's so been longer than that. And I've just been blessed, and I mean blessed, to be a part of this journey. God is on purpose, and God meant for me to be here at this time to do this work with the city, with those who care about it. That Kelly, I met you halfway through it, and it's been an honor. And I know that a lot of healthcare leaders, but as a Black woman and a mother, I wanted to fight this for you and for my children and my family. I would get choked up and I'd had to swallow down that fear like everybody had in the room. I don't want my kids to get sick. I don't want my aunties. My parents are already passed on. My husband's parents are passed on, but our aunties are alive and our cousins and, you know, and you know, you've got healthy people, right? My aunts are high 70s and in their 80s, right? And they live in Atlanta and they live in Alabama and they live in Pennsylvania. And it's like, oh my gosh, oh, look what Alabama's doing. We were so afraid for all of our friends and family and for you and for people like us. I just felt like I would fight all day and keep fighting to make sure that we have a fighting chance to live. And so it's been my honor and my blessing to be a part of this journey right now. We did not see this coming, and I'll thank you, Lord, if this doesn't happen again in my lifetime. Let some other generation take on a pandemic. Like, let's not do that. But I'm so blessed to be here, and I'm still excited to fight the fight because we're still going up. Please get vaccinated. If there are any other questions or concerns, I did not grow a tail. I am still all woman. Ask my husband. I have not. My DNA has not changed. You are not, you know, it's not going to affect your fertility. Not that at my age I care, but I am telling you, you are safe to take this vaccine. If you have a few reactions, it's because that's your body going, oh, this is what I do now. And it will learn. All of the vaccines teach your body. You do not put that vaccine into you. That's not what that is. It instead teaches your body how to fight against it, like many other vaccines do. I take an antihistamine, and now that I live in Washington, D.C. with all these doggone beautiful blossoms, I take it every day. What does that antihistamine do for me? It teaches my body not to react and sneeze and snot and get red eyes. It teaches that. We understand that about certain medicines. Let's make sure that we put this into proper perspective, how a vaccine works, because you guys are beautiful, and I'm just loving your smiles and reactions. So I hope that we do well. I see a hand, Miss Vanessa. Or is that a high five, or is it like, thank you, Jesus? What I don't know which one.
I think that's a high five and applause. And there's just one last question, just a question about the variants and just your thoughts on why some of the younger 30 and 40-year-old people we're starting to see them become critically ill with the virus, and that's a change that we're seeing in the beginning.
So there's a lot of politics that are involved in our young people. Our youngest two sons, we have 5 adult children. Our youngest two sons, the youngest one is a police officer and the other one is a college student, and they read too much social media. They read too much social media and they are misinformed and they don't trust their parents. It is very interesting that young Black males particularly do not hear the whole truth of how it's affecting them. I had to tell, I told the next to the youngest one, the one that's the father of the little girl who got coronavirus. He calls us up and he goes, I think I got coronavirus. I can't taste or smell. I think, oh dear Lord. So I Amazoned them from a distance and sent him orange juice and a thermometer because of course he didn't have a thermometer. Okay, and he said, well, I don't know if I should take it. You know, a lot of people are saying it's not for us. Us? You mean those who are dying from it, or human beings that get it? It is a misinformed population that doesn't understand healthcare and science as much as they think they do. And what we do have to do is keep talking. We can't give up on them because they do get sick and they do die. I know we had a 26-year-old, I think we had a 24-year-old here at the hospital pass away. They do get sick and die from this. And there is a lot of, when you start talking about African-American mistrust, that's born of the males, the young males, particularly, I'm not going to fall for what the man is doing. Again, this is a worldwide pandemic. This is not a Black or an American pandemic. This is not a scientific experiment. This is a real virus that's killing people. I can only just keep talking to them. I just asked my next to the youngest one on Saturday. Well, I don't know, I'm still thinking about it. I hope so, because you got it once and you can't get it again. So every time I talk to him, I'm completely cranky. And so it's like, he just sees me all cranky because he won't get that vaccine, and it is available to him now.
So it is now 1 o'clock. I want to thank you, Anita, so much for joining us. I also want to thank all of our special guests, leadership from Federal City Alumni Chapter, and also Sorrel Cheryl from our Eastern Regional Emergency Response Team Coordinator. Also, special thank you to Joyce and Tracy, the chairs of our Emergency Response Team, for helping us get this panel together and this opportunity to hear from you. I know I've been personally touched by your presence in my life, and always one time. I think I met you just in time for me to come be a guest at your hospital.
Exactly. I was like, she called me on the phone. I was like, oh, and HIPAA and all that. But I'm so glad to see you alive and well and looking beautiful. I want to thank you for having me. I am fully honored, and I thank you for your patience. I'm very sorry my meeting ran over. But I thank you for having me today. It's been my blessing.
So with that, I'd just like to close. And again, thank you everyone for joining us.
Thanks, Sorors.
Others so they can hear this great word.
All righty. God bless you all. Take care.